In 2022, a 50-year-old woman in Ontario named Sophia made the choice that shocked the world. For 2 years, she had been begging for one affordable housing with clean air. She had multiple chemical sensitivity condition where everyday chemicals made her violently. She did not. We need to talk about something that's happening because it isn't just about one woman. It's about a system where it's become easier to access than a place to live, where disabled Canadians are dying at a rate of one person per day, not because they're terminally ill, but because they can't afford to live. And the United Nations just condemned Canada for it. First, what is MAiD stands for Medical Assistance in Dying. It's basically when a doctor helps you with your life. And before you click away, and this is some choice rate, hold on. This isn't about whether people should have the right to die. This is about whether people are choosing to die because the government has. Canada legalized MAiD in 2016 with Bill C-40. And at first, it made sense. It was for people who were terminally ill, for whose death was reasonably foreseeable. Cancer patients in their final months. People who were already dying wanted to die on their own terms of death. If you could live for decades. So track one is you're dying soon. You have a terminal illness. Track two is you're not dying soon. You have a chronic condition called intolerable suffering. And here's where it gets complicated. Because intolerable suffering isn't just about physical pain. It can be suffering caused by poverty. By not being able to afford medication. Disability rights kids warned this would happen. They said, you're going to offer death to people who just need housing and support. And that's exactly what has happened. Let's look at the numbers because there's in 2016, when MAiD was first legalized, 1,018 Canadians used it. By 2022, there's been over 15. Yes. That's a tenfold increase in just 6 years. In 2023, MAiD accounted for 4.7% of all deaths. In Quebec, 7%, one of the highest rates in the world. And here's the part that should make you uncomfortable. The Canadian government started tracking disability status in 2023. And they found that 58.3% of track 2 recipients are people who are dying, self-identified as having a disability. More than half. And get this, 342 people who used MAiD said they needed disability supports and couldn't get them. Of those, 63.4% said supports were completely inaccessible. Let that sink in. People who say, I need help, and the system says, we can't help you, but we can help you die. The government tried to say MAiD users aren't disproportionately poor. But here's the thing. They measure poverty by neighborhood income, not individually. So if you're homeless in a middle-class neighborhood, congratulations, you're statistically middle class. That's a methodological disaster. And the government admits their data has concerning regards for quality and reliability. Translation, we don't actually know what's going on, but they're doing it anyways. So let me tell you about a few more people before statistics don't capture, because statistics don't capture what's happening. Remember Sophia in the video? She and another woman named Denise both had multiple chemical sensitivity. They both lived on disability payments $1,169 a month below poverty line in Ontario. And for 2 years, they begged for housing with proper air filtration, housing that would allow them to breathe, getting fire released. They didn't get it. They were both approved for MAiD. Sophie died February of 2022. Doctors will tell you, and they're not wrong, that MCS has no cure. Even with perfect health, it's a debilitating condition. But here's the question. Would Sophia have chosen death if she had a safe place to live? We'll never know, because she never got the chance to find out. Mrs. B. In October of 2024, Ontario's chief coroner released a report on a non-terminal MAiD case. One case stood out. Miss B, a woman in her 50s, chose B. The coroner reported she did so largely because she couldn't have proper housing, not because of unbearable physical illness, not because of a terminal illness, but she couldn't get a place to live. A report called this unmet social need. That's government speak for we abandoned her. How about Mr. A, an unemployed man in his 40s with a bowel disease. He had a history of mental illness and substance abuse. The coroner described him as socially vulnerable and isolated. Expert committee raised concern authorities didn't try hard enough to relieve his pain before approving MAiD. And here's the part that actually should terrify you. A psychiatrist suggested euthanasia during his mental health assessment. Think about that. You got a mental health professional for help, and they suggest you might want to consider dying instead. So why is this happening? Why are disabled Canadians choosing death? Let me give you 3 reasons. Legislative poverty. 16.8% of disabled Canadians live in poverty, nearly double the rate for non-disabled. And now we're not talking about barely scraping. On average, disabled people in poverty live about 30% below the poverty. Provincial disability, 40% below the poverty line, on average. The federal government promised to fix this with the Canadian Disability Benefit. They said it would be a once-in-a-generation opportunity to lift hundreds of thousands of poverty. And what did they deliver? $200 a month. $6.67 per day. The disability community called it CDB diet. The disability community responded with the CDB diet, showing that 67 cents per day. Spoiler, it's not much. The 2024 Disability Poverty Report Card gave the government a failing grade. Reason number 2, accessible housing. Housing that disabled people can actually use represents less than 1% of this housing. So we already have a housing crisis, and disabled people have an even harder housing fits their needs. Wait list for subsidized accessible housing, 5 to 10 years. So if you're disabled, you're poor, can't get housing, what are your options? You can wait a decade, or you can apply for MAiD and get approved in 90 days. And 3, the healthcare gaps. Canada has a universal healthcare, except it doesn't cover prescription drugs. It just started covering that. It's still being rolled out, and even that. If you're on disability assistance and you need expensive medications, you're out of luck. Some people pay $500 to $1,000 a month out of pocket. And wait times, the median wait for seeing a family doctor and getting treatment is 22 weeks. For some surgeries, that's over a year. But MAiD, Let's fast track that. In 2024, a study in The Lancet, one of the world's most prestigious medical journals, found that Canada is unique. Unlike other countries with assisted dying, Canada doesn't require that MAiD be a last resort. The study concluded that for many persons in Canada, MAiD would be more accessible than standard treatment and remedies. Read that again. It is easier to get help dying than to get help living. In March of 2025, something unprecedented. 53 Canadian disability organizations, 53, formed a coalition and went to the United Nations. 14 of them traveled to Geneva, Switzerland, to testify before the committee on the rights of persons with disabilities. And they said, Canada is violating international human rights laws. Krista Carr from Inclusion Canada called Act 2 MAiD a form of eugenics. She said Canada is ending life of at least one person with a disability every single day. Now that's strong language. Eugenics, the idea that's eliminating undesirable people. Here's her. When you're systematically failing to support the disabled people and then offer them death as an alternative, what's the difference? And the UN committee listened. And in their official report, they asked one question. How is this non-state sanctioned euthanasia? They recommended that Canada repeal Track 2 MAiD entirely. It violates the Convention on the Rights of Persons with Disabilities, and specifically the right to live life equitably and non-discriminatingly. One UN expert said it was alarming that some Canadians with disabilities are being placed in a position when ending their lives is more accessible an option than receiving support that they actually need to live their lives with dignity. Now, Canada is now internationally condemned for this. Let that sink. No. Okay, so what do we do? Because complaining isn't enough. We need solutions. And here's the thing. This isn't about banning MAiD. Some people genuinely need this option. People with terminal cancer, people with unbearable pain, they deserve to die with their dignity. That's not for debate. I don't want to have that conversation. But we need to fix the system so that people aren't choosing death over being poor and abandoned. So here's some solutions. We fix the disability benefit. The disability benefit needs to at least be $1,000 per month, indexed to inflation. That's a minimum to actually lift people out of poverty. And that needs to supplement provincial benefits, replace them. No clawbacks. This would cost us about $5 to $6 billion a year, and that's 1.2% of the federal budget. We can afford this. Solution 2, we need a national strategy to build 50,000 accessible, affordable housing units over the next 5 years. And here's the key point. Anyone who applies for MAiD citing housing as a factor should be put immediately on the priority list for immediate housing. Anybody says, I want to die because I can't find a place to live, the response should be, let's get you housed right now and see how you feel in 6 months. And the cost of that would be only $2 to $3 billion over 5 years. Again, this is something Canadians can afford. And universal pharmacare and reduced waits. We're starting to see universal pharmacare roll out, but we really do need to reduce wait times, facilities, and for doctors. It shouldn't be easier to go through MAiD than it is to see a doctor. And the wait time reduction would only cost us another $2 to $3 billion. Yes, it's expensive, but we're talking about the remediation required here. So here's a policy that fixes MAiD itself. Before anybody can approve for Track 2 MAiD, There should be a remediation requirement. Have all accessible medical treatments been offered? Have all social supports, including housing, income, and personal care, been offered? Has the person been connected to a case manager to help them access these supports? Has a 90-day period passed where the supports were available? This isn't forcing people to try everything. This is making sure that they know what's available and have genuine access. If somebody chooses MAiD after that, okay, fine, it's their choice. But at least a choice made with the full knowledge and access to alternatives. Solution 5, an independent review for social factors. When MAiD requests involve significant social factors, poverty, housing, isolation, it should trigger an independent review by a panel that includes a disabilities rights advocate, a social worker, a palliative care specialist, and a bioethicist. Not to deny MAiD, but to ensure every effort has been made to address the social factors. So let me put this straight for you right now. I'm not opposed. Everybody has their own choice. But if you're not presented all the options, are you really given a choice? Here's the bottom line. Canada is at a crossroads. We can continue down this path where we offer death to people who just need help, where disabled Canadians are dying because it's cheaper than support, or we can choose to be better. This isn't a left versus right issue. This isn't about being pro-choice or pro-life. It's about basic human dignity. And the fact that the UN condemns our country for violating disability rights, you don't have to shrug and just say it's their choice, because it's not really a choice when the alternatives are living in pain, poverty, and without a home. The solutions exist. When we know they're out there, we even know what they cost. The missing piece is political will. So here's what you can do. Share this video. More people should know about this. It's harder for politicians to ignore the more information we get. Contact your, tell them you want a disability benefit that increases to at least $1,000 per month. Tell them you want accessible housing funded. Tell them MAiD should be used as a last resort, not a first option. Support disability rights of organizations. Groups like Inclusion Canada, Disability Without Poverty, Arch Disability Law. They're fighting this every day. And vote. This is an election issue. Ask every candidate, what are you going to do about disabled Canadians choosing death because they can't afford to live? And I do have to say, this is going to become more and more of an issue as we have an elderly population getting to this disabled age. I want to leave you with this. Sophie said that the government saw her as expendable trapped. She was wrong. She wasn't trapped. She was a human being who deserved better. And so thousands of other disabled Canadians who are facing impossible choice right now. We can do better. We must do better. Thank you for watching. And if this video made you want to do something, good. Because that was the point. I'll put all of the sources and links to organizations in the description below. Let's actually fix this. And to everybody doing that out there, please stay aware.